So I'm sure that that is probably very isolating for a lot of people. So how would you start to kind of figure out, what is happening, looking at food sensitivities and how would you even start the process if somebody comes to you and they're struggling with these types of issues? So what would be the next step with that?
So food sensitivities can happen and develop from various different factors. Someone could have a lot of chronic stress in their lives. Maybe they have a poor diet. Maybe their digestive function isn't the greatest. They're not creating enough digestive enzymes, stomach acid to break down the foods properly. We would want to investigate to see if there's low motility. So sometimes people have slower digestive function because maybe they have hypothyroidism, or maybe they've had abdominal surgery and it's created some adhesions
Mm,
in their gut. We want to take a look at maybe environmental factors as well. Maybe they've had a lot of chemical exposures or medications like antibiotics that could have disrupted the microbiome. So all of these can contribute to food sensitivities, and food sensitivities develop when your body has it mistakes the foods that you're having as something that's harmful. And so
hmm.
it creates a heightened immune response, an improper immune response, creating inflammation in the gut. And then over time, this inflammation can damage the gut lining. And we know that gut lining is so important when it comes to nutrient absorption.
Hmm.
Um, when that gut lining is impaired, some of the toxins, some of the food particles can leak out into the bloodstream, and that could cause more systemic inflammation. So things like fatigue and brain fog, maybe skin issues and muscle and joint pain as well.
Yeah, I think there's also been a link to, when your gut barrier is a little impaired or damaged over time, it certainly can affect the blood-brain barrier too. There's definitely been some discussion about that as well. So you can see how brain fog definitely can be linked to those things. So does that mean, when you think about it, if I eat something like a slice of pizza, and then all of a sudden a couple of days later, I'm not feeling so good. I find a lot of the times people are looking for something that they ate, and it could be even that day, but they're not making the connection between like the long-term things that they're doing every day, every week in repetition, because most people eat very similarly every week. You're going to see the same types of foods come into their diet. And I think that, sometimes you don't even realize that it's a succession of foods that we're taking in over time that can lead to,
Mhm.
damaging the gut or inflammation and then leaky gut syndrome.